Ladies and gentlemen, thank you for your time. My name is Daniel Foster, and I'm here today to present to you an informational speech about sepsis. How many of you have ever had a loved one in the hospital? When you remember this, do you remember there being a significant elderly population in there as well? Do you remember your loved one having an infection? This is a common occurrence for many people in the geriatric population. Sepsis is defined by the Mayo Clinic as a cascade of organ failure as a result of uncontrolled infection. When the body begins losing its fight against an infection, the localized organs will release histamine, which will trigger an immune response. This response goes to the bloodstream and travels along and results in a cascade of organ inflammation, and if left unchecked, results in organ failure and death of the host. Per the CDC, the four main causes of infection from sepsis are infection of pneumonia, or infection of the lungs, UTI, or infection of the urinary tract, skin infection as a result from an open area or wound, and infection from the gut as a result of the normal body flora turning on the host. I remember when I had two patients presented to my nursing home, one of which came from the hospital with a catheter. She had been holding her urine in a previous home because she didn't want to be an embarrassment or cause too much pain on the caregivers. This this withholding of her urine was enough to cause her to develop an acute urinary tract infection, and when she presented with us, she was not on an adequate antibiotic to treat her infection, and as a result she became septic. She lost her level of consciousness. She had to be sent out to the hospital. In addition, I remember another patient of mine who came into the clinic with a mere cat scratch on her leg. She figured she would just go to sleep and wake up and would be healed the next day, but it developed cellulitis overnight, and very quickly she turned systemic and caused sepsis throughout her body. And it is important to note that not every infection becomes septic, depends on the host and the immune system response. Who is most at risk for sepsis? Per the British Journal of Medicine, the elderly, aged 65 years or older, are a common risk factor. Those with chronic medical conditions, those who have constant treatments, those with weakened immune systems or may receive radiation therapy, or children under 1 year of age as they have not yet developed their immune system fully. What does sepsis look like? Sepsis, per the Mayo Clinic, may present a variety of symptoms, including confusion or disorientation of the client. Their level of consciousness may not be what they're at per baseline. You may not recognize your family member. They may not know what day of the week it is. Very baseline symptoms that they were able to comprehend, they're now no longer able to do so. It may present with shortness of breath, a high heart rate over 100 beats per minute, clammy, sweaty skin, or an elevated temperature of over 100 degrees. It is common to have multiple of these symptoms during septic shock. The main treatments for sepsis are immediate acute care setting at the hospital. Because it is such an advanced life-threatening condition with such a variety of antibiotics that are able to be prescribed for an infection, it requires immediate lab work to know that what the attacking bacteria is susceptible to. IV fluids may need to be given to the client to replenish any fluids they've lost during the fight and infection, as well as antibiotics to treat the source of the infection. This may be from an open wound. One antibiotic may need to be prescribed, as well as a different antibiotic for the blood work going throughout the body. In conclusion, sepsis is a life-threatening condition which affects the elderly and those youngest among us. It requires proper and immediate assessment. It requires hospital treatment and antibiotic therapy. Knowing these signs and symptoms can help you save the lives of your patients. Thank you for your time.
Yay! All done. So,
Thank you.